Okay, everyone, welcome back to the lecture portion of our class. Good job on quiz one. If you were not happy with your score on quiz one and want to sit down and review information, please reach out to me. We can sit down and we can do some one-on-one review together to get you ready for quiz two and your first exam. So just let me know. We're going to start our content for the week. So we're covering preschoolers, school age, and adolescents. And then we will do our Kahoot. And like I said, we have some discussion questions. So please be engaged and involved with these discussion questions. I think you'll really like them. So starting with our preschoolers, they are growing rapidly. They double their 1-year-old weight by the time they're 5. A 3-year-old will be 4 times their birth weight, which is a lot for them. Between 3 and 6, they start growing taller. They're losing some of their chubbiness from when they were infants. They're getting all 20 of their primary teeth, learning muscle control. They will develop their hand preference by the time they're 3. And they're more adept at using old skills as each year passes. So they're learning on top of all of these skills. So our first question, at a physician visit to treat a cut knee, the mother of a strong-willed 4-year-old girl says her daughter's defiance and insistence on getting her own way are wearing her down. In addition, the need for constant watchfulness to prevent the high-energy child from injuring herself or other children or household objects adds to the parenting challenge. She says she envies a neighbor who boasts that her child is cooperative, plays quietly with friends, and cleans up toys. The mother asks what she is doing wrong and how she can get her daughter to be more like the neighbor child. How should the nurse respond? So what do you guys think?
She should let her grow into her own personality.
Yep. Every child's going to have a different temperament. What else?
I mean, more off of like what she said, because all kids are going to be different. They're going to respond differently, do differently with certain activities.
Yep.
The mother can also try to just engage with the child a little bit more. You know, if she's doing something wrong, just teach her the right way to do it, or she just have to keep helping her do that so that she can know, or the child can know what's, learn what's right and what's wrong, or how to act.
Yeah. Modeling that behavior that you're looking for, rewarding that positive behavior. I see more rules and be firm. What other things?
Maybe befriend a neighbor and kind of just ask her like what is her approach.
Yeah, learn something new. See if there's something that she's doing that you can incorporate into your personal parenting style. Yeah. Yep, showing the child how to do things. Yep. What about discipline?
I was gonna say that, but I didn't say whoop a butt, but
Yeah. What's an appropriate type of discipline for a 4-year-old?
Time out.
Time out. Yeah, that's a good one.
4-minute timeout.
Yep. So 1 minute per year of age. Yep. So 4-year-olds like to show off. They get especially excited about these new skills that they're learning. So sometimes they get overly excited and can be a little aggressive with their demonstration of new skills. So it could just be that the child is really excited about things that they know how to do. The other thing is they have a lot of energy and they're absorbing a lot of information. So they need a structured environment with lots of opportunity to run off all that energy that they have built up. So providing that time for activity, that structure, stimulating their imagination so that they're not bored and destructive. Those are all things that can be helpful in this situation. Rewarding that good behavior, modeling that behavior are all ways to improve the outcome. Good job, guys. So when we look at the preschoolers' cognitive development, they are in the pre-operational phase. So this has two separate parts to it, the preconceptual phase in our 2 to 4-year-olds, and then intuitive thought in our 5 to 7-year-olds. So intuitive thought is where they're just doing what feels natural to them. They may not understand the facts or the logic behind it. They're just doing what naturally seems right to them. And then preconceptual is where they're just learning to think through things. They're increasing their development of language and starting to use symbolic functioning. So that's where they use something outside of its intended purpose. So they would turn a box into a race car, or they're able to create a mental image of something that they can't see. Those are both examples of symbolic functioning. They are still very egocentric. They see the world in their own point of view and no one else's point of view matters. They believe in animism, which is the belief that inanimate objects such as toys have human feelings and intentions. So that's when they say their teddy bear has a boo-boo. And then also the concept of artificialism. So that is giving environmental characteristics can be attributed to human actions or interventions. So it's windy outside because somebody's blowing really hard, or the clouds are white because somebody painted them that color. Those are both examples of artificialism. During our intuitive thought stage, we are in pre-logical thinking. We're using symbols to represent words, images, and ideas. The child is engaged in pretend play. So they might use their arms as airplane wings. They might use a stick for a sword fight. Those are all pre-logical thinking and that symbolic thinking. Experience and logic are based on the outside appearance of things. So because something looks a certain way, it means this. A distinct characteristic of this thought process is centering, where they're focused on the here and now, or they tend to concentrate on one characteristic of an object and exclude all of its other features. So they might look at the size of something, and because it's bigger, it has more value. Or they might be grouping their blocks and they group them all by color, not necessarily by size or by shape. So focusing in on that one specific characteristic and ignoring everything else is centering. Cultural practices also affect the way that we grow and develop. It affects how we play, how we view ourselves and others, and affects our overall sense of values. It influences the development of a sense of initiative. And then our parents and older siblings are going to model that language development for us. So in bilingual families, you'll see where the parents and older siblings are modeling either one language at home that they speak as a family, or they're modeling a bilingual setup where the kids are in school, so they're speaking English in school, and then when they're at home, they're speaking whatever language they speak in the house. So you can see that dynamic. So there's lots of things that can cause language delays or problems with development. We can have physiological causes like brain damage, hearing loss, genetic syndromes. We can have psychological issues like anxiety disorders, ADHD, autism. Any intellectual disability can cause language delays. We also have environmental stressors like infections. So things like neonatal meningitis or encephalitis. Drugs, poverty, and malnutrition, all these environmental factors can contribute to delays. And when we're talking about language delays, we're talking about both the understanding of language and the expression. So what you can take in and also what you can produce yourself. Bedtime routines are really important starting in the preschool age. They need to have a chance to wind down before they're expected to go to bed. They like to have an established bedtime routine so that they know when it's time to start preparing and they can mentally kind of get ready for being ready for bed. They'll also do attention getting behaviors to try and get into bed with mom and dad or to prolong the bedtime routine. So parents need to be aware of that and be prepared for it. And making sure that they're not rewarding those behaviors, because that defeats the whole purpose of having a bedtime routine. For our 3-year-olds, they are involved in multiple types of play. So they start out in what we call parallel play, which we talked about with our infant and toddler discussion. That's where 2 or more toddlers are going to play next to each other, but they're not going to interact with each other. So they're both going to be doing their own thing. Then they move into what we call associative play, where they might be playing with the same thing, but they're still not really interacting with each other. They might have a conversation, but they're not going to play together. Until they get into that cooperative play phase where they're going to do the same thing together, they're going to work together, have conversations. So do things like building a tower together. So both children will work on adding blocks to the tower. They also are able to begin helping with household chores at this age. Very simple tasks will be appropriate for them. Something that is unique to them is the fear of loss of body parts or bodily harm is very unique to the 3-year-old in that preschool age group. They also become angry when others try to take what's theirs. So that egocentric thinking. So here's our next critical thinking question. A father wants to send his son to a morning playgroup twice a week. The parent is concerned that the child will not get enough attention because he's quiet and reserved. What suggestions can the nurse provide for the parent to stimulate the boy's confidence and language skills?
Letting them interact with other children just to see how it goes.
Yep.
I would say too, just letting them know in the play group that's how her child is, so they can try to kind of push him to interact more.
Mm-hmm.
I would say as a father to talk to his son to see how he feels about it and then go from there, because he'll be surprised. Maybe his son won't have an issue.
Okay. What other things can we do to develop language skills?
Interact with the child more.
Mm-hmm.
Read.
Reading.
I heard reading. Yep. You can read books, ask questions about the books. Encourage the child to answer those questions, force them to use their language. What things should we limit to a child that is refusing to engage?
Forcing.
Electronics.
Electronics, yep, that passive engagement. Yep. So getting the parents involved, other family members involved, asking lots of questions, encouraging the child to use their language, making sure that we're not giving in when they point at something or grunt because they want something, making them actually use their words for it. Those are all ways that we can encourage engagement. Helping them speak up for themselves. And then also that positive reinforcement will help to build their confidence. Moving on to our 4-year-olds, like we talked about with the first discussion question, they tend to be more aggressive and like to show off these new skills that they're learning. They do things like use scissors and tie their shoelaces. They have a vocabulary of up to 1,500 words at this point. They're going to be more interested in raw materials rather than a ready-made toy. They like to be able to have a creative outlet. So that's where they'd rather build something than just be handed something to play with. Simple stories are going to be very interesting to them, especially if they can repeat the story or be involved. And then the concept of death becomes more real to them. We need to be able to answer their questions and help them to be able to accept death without causing fear. Our 5-year-olds are going to be more responsible, less dependent on parents for those activities of daily living. They're going to talk a lot, have a ton of questions, and they're going to want to know the answer for everything. They can ride a tricycle, use simple tools with adult supervision, use all their play tools. They're going to copycat what they see mom and dad doing. They're going to have a better comprehension of computer games and television, but we need to make sure that we're moderating the amount of time that they're doing these activities. They still need limits for their behavior. They're starting to learn self-control and self-discipline, but still need a lot of help. We talked about timeouts being 1 minute per year of age. We need to make sure that we're not having eye contact or any interaction with the child during timeout, despite what they try and get us to do. And then with rewards, we want to make sure that we're not bribing the child and that we're encouraging a positive behavior when we're giving a reward. We need to be consistent and model the behaviors that we are expecting from the preschooler. Thumb sucking is an instinctual behavior. It should stop by the time they get to school age. It's not detrimental on the teeth as long as it's discontinued before those permanent teeth start coming in. The best way to get a child to stop sucking their thumb is to give them praise and encouragement. You can distract them, but really encouraging that positive behavior. So as soon as they stop, thank you for not sucking your thumb. That's really grown up of you. But then also being aware that during periods of stress and fatigue, they might regress back to that behavior just because it is instinct. Enuresis or bedwetting is more common in boys than girls. You can have 2 different kinds. You can have primary enuresis, which is a child that has never been dry before. And then secondary is when they start bedwetting after they have been dry for a year or more. There's lots of causes. It could be as simple as a urinary tract infection. They could have a disease process like diabetes mellitus or insipidus. They could be having seizures, any abnormalities of the urinary tract or obstructions, Then sleep disorders can also cause bedwetting. So as nurses, we need to do a lot of investigating to figure out what the root of the cause is. We do a lot of data collection regarding patterns of bedwetting, the number of times it happens, how often they're voiding during the day, if there's any pain with voiding, what kind of stream do they have, how much are they drinking between dinner and bedtime, any family history of disorders, stress, medications, and then where they are developmentally, especially when it comes to toilet training. So when we're figuring out the appropriate management program, we really need to focus on the child. Every child is going to be very different, especially when it comes to toilet training. So we need to make sure that we're limiting liquids after dinner and making sure the child goes to the bathroom before they go to bed. As we're looking at treatment options, we have things like counseling, hypnosis, behavior modification. We can use medications and bladder training exercises. So here's our next question. A foster parent takes care of a 5-year-old who is required to visit her biological mother every weekend. The child wets the bed for 1 or 2 nights when she returns to the foster home and then stays dry until after the next weekend. The foster mother calls the clinic and asks the nurse how she should handle bedwetting. What counseling can the nurse provide?
She probably can instruct the foster parent to have a conversation with the biological mother so they can be on the same routine as far as not giving her something to drink after a certain hour.
Yeah, making sure both households are on the same routine. That's so important.
It could be a behavioral thing too, and that from the change going from the real parents to the foster parents. It
Yeah,
could be, the anxiety and stuff like that.
yeah, going back and forth between your foster parents that you're with all the time and your biological parents that you only see on the weekends. That can be really stressful for a child. I also see not drinking anything before bed. So again, making sure we're on the same routine.
This is a pattern. She may want to encourage her to give her those little underwear, you know, for bigger kids that have accidents at night.
Yeah, just being prepared that, this is going to be a struggle for a little bit. So doing things to minimize putting that foster mother out. Yep. What else? Yeah, making sure the child's comfortable with switching houses. They might need things like supervised visits for a little bit so that the child doesn't feel like they're being abandoned by the foster parent. Should the foster parent punish the child for wetting the bed?
No.
No.
Yeah, they're not doing it on purpose. So punishment is not going to be the answer. We're going to want to reward positive behavior. So if the child makes it through the first night without wetting the bed, we want to reward that. But otherwise, we don't want to punish the child for the bedwetting. Also following a routine of every 2 hours going to the bathroom. Yep, that preventative action. What about the biological mom? What should we do for her? She doesn't have her child very often, and she only gets them for short periods of time.
maybe include her into the routine, like let her know the stuff that y'all do at home, and maybe she can mimic them when the child is there with her.
Yep, teaching her the routine, teaching her about what happens, and coming together to make a plan. Lots of opportunities for education here for a parent that wants to be involved but doesn't necessarily get a lot of time with their child. She just might not know how often the child needs to go to the bathroom. She might not know what their cues are. All those opportunities for improved education. Good job, guys. So next thing we're going to look at is preschools. So picking out a preschool program. We want to make sure that they have structured activities, that they foster group cooperation, that the kids are all playing and interacting with each other, learning those social skills. And then the development of coping skills. As they're learning how to interact with each other, they're going to need to figure out how to cope when things don't go their way. So when they are involved in a good program, they're going to gain self-confidence and that positive self-esteem. When we're looking at daily care for hygiene, preschoolers need a bath every day. Their hair should be shampooed at least twice a week. When we're picking out clothes, we want to make sure that they're not restrictive. The kid can take them on and off themselves, especially if they're going to be in preschool and potty training. They need to be washable. Our kids are going to play, they're going to get dirty. Their clothes should be easily washable. And then making sure they have sturdy, supportive shoes so that as they're playing, they're not tripping over their feet or getting injured. Like we said, accidents are very common in this 3 to 5 year old population. They're clumsy still as they're learning how to use their muscles and develop coordination. Car safety is essential, so making sure that they're using the appropriate size car seat, booster seat, teaching them to look both ways before they cross the street, not to chase a ball or anything if it rolls into the street. Burns are also very common just because the child is experimenting, exploring their environment, and not aware of the danger. Poisoning can occur because they're free to move around the house. They might see something and think it's candy. Same thing, cleaning products might look like juice. These are all potentially risk factors for poisoning. We need to teach them about stranger danger. So not getting in the car or talking to strangers, not playing in secluded areas where they could easily be picked up. Making sure that we always have indirect supervision because they don't have the cognitive ability to make those good decisions. Imaginary playmates are going to be very common during this age group. They can serve as a friend for a child that doesn't have a lot of friends. They can teach their imaginary friend how to do things as they're learning new tasks. And sometimes they will use them as a scapegoat when they're trying to get out of getting in trouble. There's a lot of educational opportunities for parents during this time as their children are going through a lot of behavioral changes. Need to teach them the appropriate use of timeout and alternative methods of discipline. And then realizing that hospitalizations are very frightening for this age group. They might see it as a form of punishment. They might feel abandoned if their parents aren't able to be at the bedside with them because they have other siblings to take care of or they're working. And this is where we see separation anxiety manifest. We see protest, despair, detachment, and regression all throughout their stay as they're getting used to being away from parents. So part of our nursing assessment is going to be determining that growth and development of the child. And a lot of this we can do through observation. So we can look at the child's approach to play. Do they join in freely or do they kind of hang back and wait for their peers? Do they prefer to be really active or like quiet activities like coloring instead? Do they talk to their playmates or do they keep to themselves? And then what type of attention span do they have? Are they able to sit and concentrate on something for a while? Are they all over the place and doing 15 things at once? All of these are important for the nurse to note. So we have a standardized form for developing or determining development. We call it the Denver Developmental Screening. And this is a screening tool that we use to make sure that kids are on target for achieving tasks that are appropriate for their age. If we notice something that is outside of the norm, then it's just an area that we need to investigate further. We're not using this to diagnose anything. It's just a screening tool. But it is helpful in giving us a baseline for where the child should be developmentally. So we're going to watch this video real quick. It takes a minute to get started.
The Denver is the most widely used test for screening developmental problems in children. Administered to children from birth to 6 years of age, it allows the clinician to identify children whose development deviates significantly from that of other children of the same age. While it does screen for possible problems, the Denver is not a predictor of later development. The Denver 2 consists of 125 tasks or items covering 4 developmental areas: personal social, fine motor adaptive, language, and gross motor. Children are only tested on the specific tasks and items pertinent to their age. The test needs to be conducted in a standardized manner and is usually done with a parent or caregiver present. Supplies for the test are included in the Denver kit along with the test scoring sheet. Prior to the test, review the test form. Note the 4 test areas are listed on the left side of the sheet. All 125 tasks and items appear on the scoring sheet. Additional directions appear on the back. To determine the task or items to be tested with an individual child, use the age scales along the top and bottom. Find the child's current age in months and use a pencil to draw a straight line from the age in months at the top to the same age in months at the bottom. You will test items that fall completely to the left of the child's age line and continue to those immediately to the right of the age line. When looking at the task or item, pay attention to the box around it. The shading provides information regarding the percent of children of that age who pass the task or item. This will be important when scoring the test. For instance, if your age line passes the task box at the 90% mark, that indicates that 90% of children pass that task at that age in the standardized sample. Ensure the supplies needed for the task associated with the child's age line are in your kit and set up your testing location. You will want to make the child and parent or caregiver comfortable. You will need a table and chairs as well as a space to stand.
Hi, Mom.
Hi.
I see you have your little boy with you today, and we're going to do a test. It's called the Denver 2. And personal social area. I'm going to ask you a couple questions under that, as well as the fine motor and language and gross motor. Okay.
Okay.
Mom, does he wash and dry his hands?
He does. He does.
Does he brush his teeth?
He does.
Maybe a little help?
I
Does he
do have
need
to
a
put the
little-
toothpaste on it, but he does pretty good.
Okay. What about putting on clothes?
Some. He's just starting.
Okay. Can he take off his clothes?
Definitely better at that. Pants, socks.
Yeah. Okay.
He loves blocks.
All righty. So, let's see what you can do. Can you build us a tower? More? And you knew there was one more over there? Can you build a tower? See how big. Good. How about another one? Can you put another one up? Good job. How about another one? Oh, no! Okay. Look what I got here.
Baby.
Baby, you knew this was a baby. Yes. Can you feed the baby? Feed the baby. So you know how to feed a baby, don't you? Isn't that nice? Okay. Can I show you something on the baby? Okay. Where is the baby's mouth? Good. Where's the baby's arms? Yeah. Where are the baby's feet? Down there, Where are the baby's eyes? Good. Where's the baby's nose? Good. Where's the baby's tummy? Where's the baby's tummy? His stomach. Where's his tummy?
Or belly?
Belly. Okay. Where's his hair? There. Very nice. You did a good job. Okay. Is his speech understandable when he talks in a sentence sometimes? Starting to put
feel
words
like
together?
it. I don't have any problems understanding him. Of course, I'm around him all the time.
Yeah.
But my mom watches him as well, and I think she feels like he speaks pretty well.
Okay, great. Okay, I'm going to show him some pictures. Alrighty. Okay, what's this? Cat? What's this? Horse. What's this? Bird? What's this? Dog? And what's that? What's this?
Dad?
Dad? Okay, alrighty. Okay, very nice. So where's the bird? Good. Where's the horse? Where's the kitty cat? Good. Where's the doggy? Okay. And where's Dad and the man? Very nice. You did a good job. Okay. Okay. So now we're going to just step around here, okay, onto the floor. All right. What's Miss Dad? Can you throw the ball? Can you throw it? Throw it. Good boy.
Good job, buddy. Good job.
Okay. Can you kick the ball?
Good job. For each task or item tested, the clinician will give the score. There are 4 different scoring options. If the child successfully completes the task, or the parent or caregiver reported the child can do the task, that task or item will be marked with a P for pass. If a child did not successfully complete the task or item, it is marked with an F for fail. If the child was not given the opportunity to complete the task, it is scored with an NO for no opportunity. If the child refused to complete a task or item, it is marked with an R for refusal. To interpret the results, look at your failed and refused tasks or items. A failed or refused task or item that was passed by 75 to 90% of children at that age in the standardization sample is a caution item. If a child fails or refuses an item that falls completely to the left of the age line, it is a delayed item. This indicates that the item was passed by 90% or more of the children at the same age in the standardized sample. Concerning results may require a repeat test and/or a follow-up with the child's pediatrician or other healthcare provider.
Okay, so that is our Denver developmental screening. Like I said, we need to remember this is just a screening tool. We can't use this for diagnosis. So this just tells us that we need to investigate further. Maybe they need to have some special interventions or at least an evaluation from their pediatrician and a specialist.
When will we use this?
So this is used, we typically use it in our toddler population. So right before they get into school age, just to make sure that they're on target and meeting those developmental milestones so that we know they're going to be ready for school. So you typically start seeing them between the 2 to 3 year mark, get these developmental screenings. So here's our next critical thinking question. So we have one parent that wants to send her child to a preschool program for 3 mornings a week. Another parent with a developmentally disabled child also wants her child to have or to experience the benefits of a group care setting for part of the week. How should each parent evaluate potential programs to determine suitability for the child? And what special features should the parent of the developmentally disabled child look for?
Make sure the teachers are accommodating to the disabilities, but don't single them out.
Yeah, making sure they have the appropriate education to handle these children.
I would even suggest maybe like smaller group programs where it isn't a lot of children all in one.
Yeah, so we need to make sure that the class sizes and the student to teacher ratio is definitely smaller than a traditional preschool if you have a developmentally disabled child.
And if the child is disabled, they usually like colorful rooms and colorful areas.
Yeah, lots of color, lots of stimulation for them. Hands-on, one-on-one care. Yep. What should we look for in a preschool overall, just in general?
Accreditation.
Yep, making sure that they're state accredited.
Making sure they like qualified to care for kids with disabilities.
Mm-hmm.
I would even look for like feedback reviews, look into the reviews of each preschool that they're potentially looking into.
Yeah. Think even more basic. What are important things to consider?
Sanitation.
Making sure it's safe and inclusive environment. Absolutely.
Even like dietary, like what they provide feedings and how often, like their day-to-day routines, like what to expect for your child to get out of their day.
Mm-hmm. Yep. Looking at what their schedule looks like. Do they provide meals? Do they provide snacks? Will they get a nap time? All these things. What activities will they do? What else?
Make sure they have a nurse there that can provide the care.
Yep. So a lot of our special needs preschools are going to have either a nurse in the room or the individual child may have their own nurse, depending on what's going on with them health-wise. Things like looking at the school fees. How much does it cost to enroll your child? How late are they open? Will you have to get off work early to be able to pick your child up? Making sure that they have a safe environment, appropriate sanitation, what their philosophy is regarding teaching and discipline. Do you think they'll be able to do a standardized general lesson plan in a school that specializes in intellectual disabilities?
No.
No, those kids are going to be very individualized and each child's going to need their own lesson. so that they can be engaged and involved. So those are all important things that we need to look for when we're evaluating a preschool program. Questions about preschoolers? Okay, we'll move on to our school age kids. So starting with our 6 to 12-year-olds, they are going to be more engrossed in fact than fantasy. Their interests are going to be role playing, learning about their environment through play. They're going to develop their first close peer relationships outside of their family. They're starting to be judged by their performance. So whether through school or sports, they're starting to learn that they're being judged. Also developing a sense of industry. So figuring out what motivates them, what they enjoy. Learning that positive self-esteem is going to be influenced by their peer group. They're starting to progress from just having the skill of writing or reading to actually being able to understand what is written and read. They start working towards delayed gratification, so having to wait before they are rewarded for their actions. And then parents need to be aware that multiple unsuccessful experiences can lead to a development of fear of trying. So if a child is repeatedly struggling with a skill, they're going to be less inclined to try it again because of that negative consequence. So the more positive reinforcement and encouragement we can provide, the more chance that they will continue trying to master that skill. We're in Erikson's stage of industry, so finding those things that motivate us. Freud's stage of sexual latency, where we're focusing on same-sex friendships, we're learning our role identity through observation. And then also Piaget's concrete operations. So we're beginning to learn logic and classification of objects by similarities and differences. And we're beginning to see how parents and teachers respond to situations and how willing we are to try new things. For our physical growth, we're starting to slow down just before we hit puberty. They're going to gain weight more rapidly than they're going to grow tall. And their brain size has reached the approximate size that they'll have as an adult. They have improved muscular coordination and a low center of gravity. They start losing their primary teeth around 6 years of age, and they'll get 4 permanent teeth per year at this point. Their GI tract is going to be more mature. Their stomach capacity is going to increase. They're not going to need as many calories to function. Their heart grows slower than the rest of their body, so it stays smaller in proportion to their body size. We want to make sure that we're not equating size with emotional maturity, because you'll start to see very different growth rates at this age. And we can have problems when a child faces higher expectations because they're taller or heavier than their peers. Same thing, we'll start to see bullying and exclusion because they're not in that average look. They're learning gender identity. Their sex role development is going to be influenced by their parents mostly. And they'll start to observe differential treatment and identification within their family and then within the community. You'll start to see the influence of the school environment, where you might see some of these stereotypes being introduced, like aggressive behavior being more accepted in boys than in girls. And then you'll also see the incorporation of traditionally masculine or feminine positive attributes, leading to fuller human function. We need to make sure that parents are setting realistic goals for their children. They need to be aware of attendance problems, tardiness, any early warning signs of loneliness or depression. And they need to start that open communication at a very early age, so that when they're older, they are already used to having this dialogue with their parents and have developed that trusting relationship where they can have difficult conversations. We also want to teach parents that homework is the responsibility of the child. It's one of the first things that they learn to do on their own and can have responsibility for. When we're talking about sexuality with this group, we want to be aware of any slang or street terminology that's out there. A lot of children hear these words, but might be confused about their meaning, or might be completely oblivious altogether. So making sure that parents are aware of what's out there and what their children are exposed to so that they can help them with any misunderstandings they might have. Looking at our 6-year-olds, they are energetic and on the go. They like to start things, but don't have the follow through to finish them. They talk for a purpose rather than just to hear themselves talk. They still require a lot of sleep. They need 11 to 13 hours a night. This is when you're going to see them prefer to associate with children of the same sex. So the boys are going to want to play together, the girls are going to want to play together. They need extra time and support adjusting to school. So this whole new environment for them, a lot of expectations that they're not used to. So giving them a lot of encouragement. We also need to watch for signs of fatigue and stress as they're adjusting to this new routine. They're going to be exposed to more infectious diseases just because they're exposed to a lot more people. So we need to stress the importance of immunizations and staying on top of them. Our 7-year-olds, they have high standards for themselves. They start to develop their sense of humor. They will be more modest just because they're starting to notice the differences between boys and girls. They're going to enjoy being active, but also enjoy periods of rest. They're starting to learn things like seasons, months, beginning math concepts. And then active play is still going to be important. Their hands are going to be steadier, so they'll be able to do some more complex tasks. And then they're going to be starting to work on independence. Our 8-year-olds want to do everything. They can play alone for longer periods of time. They enjoy creativity, group activities, and competitive sports. You'll notice that they like to be argumentative. They might behave better for company than they do for their immediate family. You'll start to see things like hero worship. And their arms and hands are going to grow faster than the rest of their bodies, so they get somewhat an awkward appearance. And then we also need to teach them how to express anger in an acceptable manner. Our 9-year-olds are going to be dependable. They're going to have more responsibilities. They'll show interest in family activities like board games, family movie nights. They are more likely to complete tasks when you give them to them. Worries and mild compulsions are very common in this age group. Their hand-eye coordination is well developed. They're able to accept criticism for their actions. They're starting to work on perfecting skills. Their permanent teeth are still erupting. They need 10 hours of sleep each night. And they're going to be more active in competitive sports. So we need to make sure that they're using the right techniques and that they're using their safety equipment. So here's our next question. A shy, reserved 8-year-old child tends to isolate himself from other children and doesn't want to be part of the group. What type of interventions and guidance can the school nurse provide?
Get him to join activities.
Mm-hmm.
figure out why he don't want to be a part of the group just by asking questions and get, just trying to figure out if there is a problem, what is the problem and how it can be addressed.
Yeah, absolutely.
She or he can ask the parent what activity the student likes to do outside of school and try to coordinate it with the school.
Mm-hmm. Getting them involved in something that's important to them.
And checking for hearing and learning deficits.
Absolutely. Hearing deficits, learning disabilities, any health issue could be causing this isolation. What types of, I see encouragement and reintroduction to the children. Yep. Getting them a buddy that can help them to be included in things. Assure the child they'll be safe. Yep.
Start to create a like friends to come over to try to introduce the child to other kids.
Yeah, giving them a social interaction in their own safe space. Yep, if you bring the other children to them, they might feel safer in their own environment. What relationship should we be looking at?
Like the relationship between the parent and the child?
Yep.
Is that what you're referring to?
Yeah, parent and child, teacher, child, all of these could be influencing the child's comfort. If there's a problem at school that's making them isolate and they don't feel safe going to their teacher, that might be an issue that needs to be addressed. Same thing, if they're being bullied by their friends and they don't feel like they can go to their parents, then that could be a potential issue that would be causing this isolation. I see Kenya mentioned a pet. So if they have a family pet, putting them responsible for that pet can help them to learn those socialization skills, even though it might not necessarily be with a person. It still helps them develop those skills that they need.
That's it. It's gonna tell you how to do it, right? Oh no. Mm-hmm.
Yep, teaching the child role playing so they learn how to be a leader and learn how to engage. Yep, those are all great ideas.
Okay, we on 12th Street. We not far. And then here's tomorrow. It's on 12th Street. So we gotta go to 6th and M.
Okay, let's look at our pre-adolescents. So our 10-year-olds mark the beginning of pre-adolescence. This is where girls start to physically mature a little bit faster than boys. They begin to show self-direction and want that independence. Group ideas are going to be more important than individuals. So they're going to tend to follow what the general group of friends wants to do rather than just what one specific individual wants to do. Sexual curiosity is going to continue. Our girls tend to be more poised than boys. This is where we start to see that introduction of slang terminology. The child's going to begin to identify themselves with skills that pertain to their particular sex role. And they're going to take more interest in their personal appearance. And cognitively, they're going to know abstract numbers. So they're going to start to begin to understand abstract thought. Our 11 to 12-year-olds tend to be intense, observant, and energetic. They're going to be more argumentative and meddlesome. They're going to be ruled by their hormones. So their hormonal influence is going to impact both their physical growth and then their cognitive abilities as well. They need freedom within limitations. So understanding that they're young adults at this point, they can be independent, but also keep giving them limits to keep them safe. They tend to be less concerned with appearance. Their ability to concentrate decreases. They might seem preoccupied. They're still going to be really involved in group activities, group sports. They're going to be interested in their bodies and watching for those early signs of puberty. And when we're providing discipline, we need to also provide the why behind the discipline. So they need really short and simple explanations and the reasoning behind why the discipline has been enforced. They will ignore constant verbal nagging at this age. And this is when we need to teach them responsibility through the use of chores. They'll have various health examinations, typically start in the spring before they start school. Also can be given if we notice some inattentiveness at school. They might be screened for vision, hearing, language, or learning deficits. And then they'll also get physical assessments when they're doing sports and cognitive assessments throughout school. During our health examinations, we need to make sure that we're using simple explanations of any illness. We also need to make sure that students have time and place to study. So even if they're hospitalized, they're still going to be responsible for their schoolwork and their learning. So they're still going to need that appropriate time and place to be able to study. We also need to encourage them to take responsibility for their assignments and their school supplies. And then this is an age where an allowance or any means of earning money is a great opportunity to let them learn the value. So another critical thinking question. We have the parents of a 7-year-old immunocompromised boy say they want to get a dog for their son. The parents tell the nurse that they have read some studies about the positive influences and benefits of pet ownership, but they want to know what risks may be involved. What information can the nurse provide the parents about some of the diseases transmitted by dogs to humans and how the parents might protect their children from these risks? What do you guys think?
We
Would it be
can
like
educate them.
a tetanus shot?
Yep, making sure they have their shots.
And educate them about parasites and rabies, like the child is already immunocompromised, so.
Yep. What
Teach
other
them about emptying cat litter or
Yeah, making sure they're not coming into contact with the animal's saliva or their urine or feces.
Oh, standard precautions like hand washing a lot.
Yep, absolutely. Yep, hand washing. Should the pet be allowed to sleep in bed with the child?
No.
No. Nope, that's not going to be a good idea for this family. What other things do we need to do?
They can get a hypoallergenic dog as well.
Yeah, making sure that we're choosing the right animal for the family situation, making sure that they're healthy, making sure that we're using an appropriate food that doesn't have the opportunity to introduce more challenge or more opportunities for infection, things like that.
make sure the dog also has its shots.
Yep, the dog needs its shots too, making sure we're doing flea and tick prevention. Yeah, all those things. Good job, guys. You caught on to that really quickly. Okay, last ones, our adolescent population. They tend to be the most difficult. So our adolescents are marked by the appearance of those secondary sex characteristics. That's the beginning of adolescence, and it ends with the cessation of growth and emotional maturity. So we have early, middle, and late adolescence because of all of the changes that they're going through and the expanded age range. So that 13 to 18. During this time, their major tasks are going to be establishing their identity, separating from the family, initiating intimacy, and developing those career choices for their economic independence. They have lots of challenges that they face. They have physical and psychological changes that are going on, making sure that we're maintaining their privacy. They're learning how to cope with social stresses and pressures. We want to make sure that we're maintaining that open communication, and then developing positive healthcare practices and lifestyle choices. So they are going to be surging towards independence and are often difficult to get along with their parents because of that need for independence. Their bodies are going to be rapidly changing. Their hormones are fluctuating left and right. Conformity is going to be one of the strongest needs that they face. So they are getting into Erikson's intimacy stage, where they're developing self-esteem. They're also engaged in peer relationships and worried about fitting in. Piaget says they are in abstract reasoning, where they are starting to learn problem-solving behaviors. And then Freud says they're in the genital stage, which is where they're starting to develop feelings for others. So adolescence is marked by rapid changes in structure and function of their various body parts and is distinguished by puberty. So typically during childhood, boys and girls are going to produce somewhat equal amounts of androgens and estrogens. When they start to enter puberty, the hypothalamus is going to signal the pituitary gland to stimulate those other endocrine glands to secrete hormones. And that's what's going to give us those secondary sex characteristics. So here you can see all the physiological changes that are happening during this age group. So there's lots going on. The age of puberty is going to vary, typically occurs earlier in girls than boys. And then they'll have a final growth spurt by the time they hit 18. One of the major causes of weight gain is going to be their increase in skeletal mass during this time. Their general appearance tends to be awkward. They get to be long-legged and gangly because their body parts are going to grow and mature at different rates. Their sweat glands start to become active. They have oily skin, and acne are common problems that they face. The boys are going to start to develop hair on their face, chest, underarms. Their shoulders are going to widen. Their pectoral muscles enlarge. Their voice deepens. We need to teach them testicular self-examination at this point. Same thing for our girls. They need to do breast self-exams as they're starting to develop their breasts. They'll also have fat deposits in their hips and thighs. And they'll have the onset of menstruation or menarche. Typically occurs between 12 to 13 years. And one of the things that we need to teach them is the importance of balancing their energy, activity, and nutrition when they're going through menstruation. We evaluate development through Tanner's stages of sexual maturity. Psychosocially, they're developing their sense of identity. It's going to fluctuate throughout adolescence as they're trying to figure out who they are as an individual. And it's going to be molded by all of the different people that are important to them in their life. They're also going to develop a sense of intimacy, which is going to be closely entwined with their identity. They're going to have a lot of experimentation that they do during this time to figure out what makes them happy. They're also going to need practice in decision-making. At this point, they're going to be evaluating what things are important to them, if they want to continue to believe the same things that their family believes, or if they have beliefs of their own that are more important to them. They're also going to be very concerned with their body image. They think that everybody is looking at them. They also take pride in their abilities, and they make every effort to be like their peers. So here's another opportunity for discussion for us. A patient's mother complains to the nurse that her 14-year-old son has become increasingly lazy in the past couple of years. He lies around the house and sleeps all day on Saturdays, and he complains about being tired a lot. How could the nurse explain this behavior?
He's probably up all night playing games.
Could be.
Could it be a sign of like depression?
It could be a sign of depression.
Anxiety.
Hormonal imbalance.
Well, it
Yeah,
could be
their hormones are going crazy right now. Is this normal for this age group?
yes, I think so.
Yes.
Yes.
It
Yeah.
goes all the way to 19 though.
Yeah, yep. So what things can mom do to help her son cope with this?
Get him in sports, therapist.
Discussing if there's anything currently going on that he needs to discuss or, you know.
Yep, activities, open communication. What else could be causing the fatigue? What else could be lacking?
Maybe his diet, because young kids tend to not eat right.
Yep, absolutely.
Or their sleep pattern can be all off. They can be up all night and sleep during the day.
Yep, their sleep pattern can be off. They can have poor nutrition. Those are all things that could be contributing to his sleepiness and overall fatigue. Yep. Anything else? Good job, guys. I think you guys responded the quickest to that one.
Currently dealing with it.
So you've got firsthand experience with that one. Okay, peer relationships are helpful to the adolescent to help them feel like they belong. School's going to be an important role in this because they're going to be with their other students for 8 hours a day. That's where the majority of their relationships are going to happen. Belonging to a group is going to be really important. You're going to start to see the formation of cliques. And then they're going to find that best friend, that close personal relationship with someone of the same sex. And that's going to be vitally important in helping them define themselves. They're in Piaget's stage of formal operations. Their development is still going to be very systematic, sequential, and orderly. They're still in that concrete phase of thinking, but by middle adolescence, they start to be able to think abstractly. Our older adolescents can see situations from a lot of viewpoints, and they start to have that abstract thinking. So when we're providing education, we need to focus on the concrete issues. We need to be able to sympathize and empathize with the adolescent, understand their own values and actions, and that they can understand and accept differing values and actions from others. They're starting to meet and become acquainted with members of the opposite sex. They're starting to get into things like dating. They typically start in group dates where they're loosely associated with somebody, but they're all more so hanging out in a group atmosphere. Then they'll go on couples dates where they'll have either a double date or a group of couples that go out and do the same activity together. And then they'll eventually evolve into single couple, where you just have two people that are in a relationship together. Sexual experimentation is common in this age group as a response to peer pressure. it can affect their growth and development overall. You can have things like unplanned pregnancies, sexually transmitted infections, because few adolescents are going to use protection. Sex education is extremely important. It's challenging for the adolescent just because it's uncomfortable and awkward. It should be presented in an age-appropriate manner. We need to review coping skills for dating, sexuality, pregnancy, birth, also abstinence and contraception. We need to emphasize decision-making and helping them to understand the decision-making process. Just because we're providing the information doesn't necessarily mean they're going to have a higher rate of sexual activity, but they will be more informed and hopefully make less risky behaviors. They're going to be concerned about being different from their peers. Sexual maturity is not going to be the same for every child, and that can be a cause of concern for them of being made fun of because they're not as mature as their peers. Also, homosexuality is common during their phase of experimentation, and it's not necessarily a positive predictor of their adult sexual preference. Parenting is extremely difficult as parents might be unsure of their own opinions and might be hesitant to exert their authority. They might not need, or they might not know how to talk to their teens. Teens are also not going to know how to talk to their parents. So keeping those lines of communication open, that's why we talked about establishing that as a norm for the family way back when they're preschoolers. And then helping them sort out all of these confused feelings that they're having. They're learning a lot about themselves during this time. We need to watch for warning signs for intervention, like spending time on the computer in the early hours of the morning, changing the screen as soon as their parents walk in, having pornographic materials on their computers, making frequent long-distance phone calls. These are all warning signs that they might be engaging in inappropriate activities. They're also at risk for nutritional deficits. They like to skip meals, they snack a lot, tend to eat out more, so not making the most healthy decisions. They tend to have low levels of calcium, iron, and vitamin B12. You have peer pressure influencing their diet, so they might be trying different diets that are out there, like vegetarian diets, which can impair their absorption of iron. So one of those things that they're already struggling with can be influenced even more by their diet. Then we have sports that play another role in their nutrition. Our athletes tend to exhaust their reserves of glycogen. So we need to make sure that they're eating slow absorbing glucose and preventing that chronic low muscle energy stores. We need to limit caffeine and alcohol that can cause dehydration. And then watch for the use of anabolic steroids that can be detrimental to bone growth. Personal care is important. We already talked about the fact that their sweat glands are in overdrive. They're producing a lot of oil, so they need to bathe more frequently. We also need to teach them appropriate care for any body piercings that they might have. And then they're going to be at risk for cavities just because of their eating style and their lack of hygiene. And then we need to teach them the importance of sun protection to prevent skin cancer when sunbathing starts to become more influential, and then protecting their eyes as well. Safety is important for them. They are at high risk for motor vehicle accidents as they don't have the developmental skills quite yet. They're just learning how to drive. They're going to be more likely to be influenced by their peers to make riskier decisions. We still need to teach them water safety and making sure that they know how to swim. Contact sports are still going to be hazardous, making sure that they're wearing appropriate protective gear, making sure they're not hitting too hard, that they're following the right protocols. Then we have the female athlete triad. So this is where we have eating disorders, amenorrhea or absence of menstruation, and osteoporosis all linked together. So our most common eating disorders are going to be anorexia and bulimia. Then primary amenorrhea is going to be the absence of menstruation in someone that hasn't had a period by the age of 15. And then osteoporosis is those weak, brittle bones. Drug use is also a common problem for adolescents. We need to educate them on how to say no, be informed about what's out there. They're going to feel that need to conform to be accepted, making sure that they're prepared for that. They're also prone to mood swings as they adjust to all of these changes that are happening in their life. So one of the nursing assessments we use is called PACE. We evaluate parents, peers, and pot, alcohol and automobiles, cigarettes, and education. So if we find 2 or more of those letters that are problem areas, it means the adolescent may be at risk for drug abuse. And at that point, we should make appropriate referrals. Drug use can precede the development of depression. Some of the early warning signs are a change in school performance, their appearance, or behavior. Any threat of suicide is a call for help that has to be addressed immediately and taken seriously. The school nurse can be helpful by recognizing those warning signs of depression, encouraging open communication, posting the numbers of available hotlines, and then providing those professional referrals. Another problem of adolescence is pregnancy. So not only is the young girl trying to deal with her own development, but now she's also growing another human being. Some risk factors associated with adolescent pregnancy are the age at which she becomes pregnant, her nutritional intake, sexual activity, and limited access to healthcare. Some of the tasks of an unplanned pregnancy are first confirming the pregnancy itself. During the second trimester, we really want to focus on the newborn and what's coming. And then during the third trimester, we can prepare for the whole birthing process. When we're approaching adolescence, we want to make sure that we have open lines of communication. We want to make them feel at ease before we start providing care or education to them. A lot of times these adolescents don't feel comfortable talking to their parents because they're afraid of being punished or judged. So they may only feel comfortable talking with a nurse or healthcare professional that they don't have to see again. We want to make sure that we provide privacy, ensure their confidentiality and respect so that they feel like they can have those open conversations with us. And then know that any hostility might just be because they're afraid of what they don't know and they don't know how to express it. Rebellion may also be an effort at trying to grasp that independence. And then we need to guide parents in listening and understanding and sharing with their adolescent. There's lots of opportunities for teaching at this age. We need to look at nutrition, hygiene, accident prevention, substance abuse, risk-taking behaviors. We also need to teach them self-control, money and time management, and then using those open-ended questions. So here's our very last question for the day. A parent tells you that his 15-year-old daughter has suddenly entered a period of rebellion and is breaking all the household rules. Last night, she came home an hour after curfew with no explanation, and she often becomes angry and sullen when disciplined. The parent asks the nurse why his daughter's behavior has suddenly changed and what he can do to stop it. What advice should the nurse give?
have a conversation with his daughter, a one-on-one conversation.
Yep.
She's trying to find her identity, so she's a little confused.
Yep. Identity confusion.
Get someone in that can be a mediator between the two.
Yep. Sometimes having a third party is great. How do we want to approach the conversation?
First, I would
Maybe was making her act this way.
Mm-hmm.
Open-minded.
Yep, very open-minded. Making sure that we're calm, having an open-ended conversation, making sure that we're approaching it from wanting to make sure the child is safe rather than judging their actions. What other things can we do?
Counseling, maybe.
Counseling, yep, that could be another helpful opportunity.
Some disciplinary action.
Yep, I'm sure there's going to be some sort of consequence that comes along with it. But when we provide that consequence, we also need to provide the reasoning behind it. So you're grounded for the next week because you stayed out past your curfew. When you do that, it makes me really worried that you're going to get into danger somehow. And I really want you to be safe. So making sure that we're providing those extra tidbits instead of just focusing on the punishment. Good job, guys. Okay, that is all that we have for our slides. So do you guys have any questions over the material that we covered? That is the last of our age groups. So now we can just focus on body systems and disease processes. So I am going to pull up our Kahoot now, and we can do that together. Let's go over some of these. Let you guys get logged in. If you guys can't get logged in, you can just follow along as we're going. Okay, let's go ahead and get started here. A preschool child is asked, why do trees have leaves? Which response would be an example of animism? And that is to hide behind when they're scared. So that's when we're giving an inanimate object human characteristics. So hiding is going to be a human characteristic, something that we know trees can't do, but that is a human action given to an inanimate object. Cephalocatl describes development that proceeds from head to toe. So we talked about that week 1, where an infant is able to lift just their head before they're able to sit up on their own. We also talked about proximodistal, which is where development works from the midline out. So they're able to do big movements with their arms before they're able to do fine motor skills with their fingers. An appropriate task for a 5-year-old is going to be setting the table with paper plates. Probably don't trust them just yet with real dishes. So paper plates are lightweight and they're able to manipulate those pretty easily. We definitely don't want to give them any task that could put them in danger or risk of injury. So we don't want to be giving them things like knives. Also, probably don't want them carrying glasses in case they would trip and fall. And then have the glass break. And then we definitely don't want to encourage them to be using cleansers because we don't want them to potentially have that risk of poisoning. So not letting them use cleansers independently. A father is concerned about how long his preschool age child will continue sucking his thumb. What is the best response? So the best response is that most children will stop sucking their thumb naturally by school age. We're not going to cause damage because they don't have their permanent teeth yet. We don't want to do bad tasting liquids. We'd rather provide distraction and positive reinforcement. You can distract the child, but the key is going to be that positive encouragement. The way a child grows and develops is known as maturation. Development is going to be focused on the acquisition of skills. Growth is going to be looking at their physical growth, and then physical size is just their appearance. The most appropriate toy choice for a 3-year-old is going to be a large construction set. Goldfish is an animal or a pet, not really something that they can play with. Board game has the potential for small pieces. Also, they require somebody else to play with them. And if you remember, a 3-year-old is going to be more so in that parallel play where they're not really playing with other people. And then push-pull tops, again, could potentially be a choking hazard. The fear unique to the preschool period is bodily harm. So they are concerned, they don't understand that there are non-essential body parts. We often see this expressed during toilet training where they don't realize that it's okay for things to leave the body. So the Denver 2 is a screening test. So it indicates the need for further investigation. So we can't use it as a diagnostic tool. We have to use other methods to actually diagnose a delay. So it just tells us that we need to refer to a specialist and have them evaluated. When planning an activity for a 3-year-old child, the nurse bases a plan on the average attention span of 15 minutes. So general rule of thumb is 5 minutes per year is about the attention span that they have. So a 4-year-old child insists he has more money with a nickel than his father who has a dime. Per Piaget, why is this true? The correct answer is intuition. So that's where they're just going off of their gut and they're looking at one characteristic rather than the whole picture. So because the child has a nickel that's bigger in size than the father who has a dime that's smaller, they think their bigger coin has more value than their father who has a smaller coin. Does that make sense? Okay, that one was a tricky one, but we're looking at that kind of centering and that intuition. So what do we need to keep in mind when we're teaching a fourth grade class about nutrition? And that is going to be that school age children think logically and concretely. So that school age population, they don't understand abstract thought yet. So we need to make sure that we are giving them logical reasoning for their nutrition choices and making sure that we're giving them concrete examples. So the traditional family of one mother and father and their biological children is the nuclear family. A blended family is going to be children from previous relationships. Extended family is going to be aunts, uncles, grandparents. And then communal family is going to be those non-biological members in the community. If a new mother cannot breastfeed her baby, the next best thing is going to be that iron fortified formula. So we're making sure that they have those good iron stores as they are weaning off of what they got from mom. An 8-year-old child has frequent nightmares and the parents are concerned. What is the nurse's best response? And that is that nightmares are a normal extension of the child's fear of mutilation. So the child's fear is going to be what triggers their nightmares. So if you remember that bodily harm is one of the things that is typical of or a big concern for this age group. So that's where that fear comes from. A 10-year-old girl likes school, plays the flute, and plays tennis. What do these activities help develop? That's going to be her sense of industry. So those are activities and things that motivate her, things she enjoys. Commonly confused with identity, where we're looking for characteristics that make that person them. So that's the line between industry and identity. They are frequently confused. What statement by an 11-year-old child leads the nurse to determine that he has moved from the mindset of egocentrism? So we've moved past that. The answer is, I'm sorry, I bet that hurt your feelings. So in egocentrism, they're worried about themselves. Nobody else has a perspective. So once we move beyond that, we're able to see other people's perspectives and gain an understanding of them. So looking at other people's feelings. The school nurse is preserving a tooth that was knocked out. What will the nurse be especially careful to do? And that is handle the tooth only by the crown. So the part that actually sticks out that you can see in your mouth, you want to make sure that you're only touching down there and you're not touching up in the root. So a baby up to 4 weeks old is going to be a neonate. So that first 4 weeks of life is their neonatal period, and then they would move into that infant period. So physical changes that indicate puberty has begun in a male, that's going to be enlargement of the testicles. So those secondary sex characteristics. A parent comments that her adolescent daughter seems to be daydreaming a lot. What does this behavior indicate? That is that she's mentally preparing for real situations. So teens use daydreaming as a way to think through all the possible consequences and things that could happen in real situations. So you'll catch them daydreaming about things like marriage or what their life is going to look like when they're older. All those things are helping them to prepare for life as an adult. The nurse is planning care of an adolescent. What psychosocial task is most important for the adolescent? And that is going to be their sense of identity. We talked about teens are all about trying to figure out who they are as a person. Our first tooth generally appears at about 6 months. So a good source of zinc for an adolescent that is a vegetarian is going to be nuts. So a lot of their protein and zinc will come from nuts since they don't eat meat. Height, weight, and vital signs fall into Maslow's hierarchy of physiological needs. So just basic physiological needs of the infant. When we start solid foods at 6 months, we want to start with rice cereal because it's easy to digest, it's easy for them to eat, and it's got the least risk of causing an allergic reaction. According to Freud, sucking on a pacifier is part of oral development. Oh, sorry, guys. Our toddlers are going to be in autonomy versus shame and doubt, according to Erickson. Trust versus mistrust is going to be our infants. Initiative versus guilt is going to be our school age population. And then industry versus inferiority. So the protrusion reflex is what causes infants to stick out their tongue when you place solid food on it. Last question. A girl tells the nurse, "I love Katy Perry and I want to be a singer." This statement is typical of what stage? That's going to be early adolescence. So that's where you're going to have your 13-year-olds that are going to be really interested in celebrities, and that's going to be their main source of influence. So that's where they're going to place their emphasis. So they're not necessarily going to have a concrete idea of what they want to do when they grow up. They're just still kind of daydreaming about it. So Deja is our winner tonight. Congratulations, Deja.